I would like to make sure that you also are included in the plan. I really don't want to see exclusions in there that say that, because you're public or, government employees, that you have your own plan and will not be subject to that plan. Thank you.
This issue of everybody being forced to go on a public option plan, if we already have one, I will not vote for anything that would force anybody onto a public option plan if we're to have one. It needs to be an option. And it needs to be there as a last resort, as a safety net. And that's my goal behind looking at it. That's why I support it, because I do believe that there should be a safety net that has shared responsibility with a sliding fee scale on it. So thank you for sharing that, and that is a lot of confusion, and we'll make sure that as a public option as it is discussed, that we'll have information up on our website, and we'll cite all of it so you can do your own research as you have been doing. Thank you.
Thank you. My name is Bob. On the day after Christmas, 4.5 years ago, I was in the Pacific and I met a wave that was a lot stronger than me. It turned me upside down, broke my neck, and I've got a spinal cord injury that I get to live with. Could have been a lot worse. Catastrophic injuries don't change a person's life. I was out of work for 2 years. Regular insurance covers 120 days typically in long-term care. I was there for almost 2 years, so Courage Center and rehab cost $30,000 a month, so guess what? My wife and I split our assets in half. I had to pay mine down to $2,000, so I was eligible for medical assistance, so we were bankrupt. Most of the people there faced that. I'm one of the lucky ones, so I'm not complaining. I'm back to work. I love working. I'll work and hopefully till the day I die. But here's my problem. I'm back to work. I was fully insured when I got hurt. I never gave up my private insurance, but I still have to stay on medical assistance because private insurance isn't required to pay for my needs, whether they last 1 day related to an injury or they last 20 years. So I have to pay for medical assistance and Medicare for the rest of my life so I can get personal care attendants paid for. I better move along here. Here's the worst kicker, that when I turned 65, I'll be forced onto Medicare, and the government will force people to take my pension. They'll take my income if I'm working. They'll take my investments, my deferred comp down to $650 a month. If my spouse isn't surviving, I'll be at poverty level. The government will take any assets I have remaining when I die, so that none of my sons will get none of my assets. I forget what it's called, but they take it because I'm a medical assistant. I want an insurance system that is fair to people with physical disabilities. Everybody here is one bad accident away from possible bankruptcy, poverty, and this system doesn't work for me. It doesn't work for anybody with physical disabilities. I've worked my whole life, starting at age 6 on a family farm. I'll keep working. But you know what? This system just doesn't work. I'm forced to be a medical assistant. I would like not to be. So thank you for your time. And it's a disincentive to work. I want a system that doesn't disincent people to work. Yes. When I'm 65, it tells me I can't work any longer. It takes my income anyhow. I'd like to keep working, and with private insurance or public, I don't care. Thank you very much.
That's the whole issue about being able to work and have access to insurance or personal care attendants and all that, with the way that it's set up, not only in Minnesota but across the country. I believe that it takes away, an individual has much to contribute through working with the way the insurance is. And when I was here in the State House, I worked on something called Ticket to Ride and Ticket to Work. And I'm involved in that federally too, and we would love to have your input and engagement as we move forward. So let's talk some more. I'll have one of my staff come find you afterwards, and then we can have a longer conversation. Thank you.
One thing I've got, I pay $700 a month for my insurance above and beyond my able-bodied peers. About $8,000 a year.
Thank you.
Next up, 172, 126, and 69.
Representative, thanks for having us tonight. One thing when I begin, I'm a loyal, my name is Joe Remley, I'm from White Bear Lake. I'm a loyal conservative Republican. And I'd like to start by asking that young man with that sign over there if he could put it down. I didn't support Obama. I don't support President Obama, but I just find that uncomfortable. My concerns tonight have to do with a couple of things. Early on, we heard about the high profits corporations. I want to remind everyone that corporations cannot take your money. Corporations cannot take your property. Corporations cannot take your liberty. Only government can take your property, only government can take your liberty, and only government can take your money. I was in Washington, D.C. recently, and it is a wonderful place to go. Representative McCollum's office was wonderful to us. They helped us get into facilities, helped us on tours, and they were very nice to us, even though we were Republicans. But the place is so large, so big, with so many responsibilities, there is just no perspective on what it takes to get almost anything done. We elect you, and immediately everybody here expects you to be an authority on just about everything in the world. It's not possible. And subsequently, it's not possible for the government to run a health care program. As much as we all would like it to be that way, it's just not possible. And I heard numbers over the last 3 or 4 months that 40 million people are without health care. Now, I seriously question those numbers. But tonight, that number has already ballooned to 60 million. And that ballooned in 2 months. So those are my concerns.
Well, first off, true confessions, I love Republicans. My mother was a Republican. The number that I used up to 60, and it's always good, and thank you for wanting to verify my numbers, is I used a number up to 60 of people who are either without insurance or underinsured. There's some people who have catastrophe insurance, but then it doesn't cover diabetic needs, insulin syringes. It might only cover extreme hospitalizations. So I counted them as underinsured. Thank you for your comments about government. I happen to think that what we're talking about doing with holding the insurance companies accountable with some of the reforms that they've offered to do, finding a way to have accountability and transparency in that, and then looking to improve options to make sure and I think that there's going to be, in my opinion, a public option needed to make sure that there's a safety net plan that's there for individuals. It's going to mean that we have to be very vigilant. We have to hold the government to a high standard, and I thank you very much for sharing your concerns.
Hi, my name is Susan. I'm from Mendota Heights. Mrs. McCollum, I